from what I understand, like, that's just like shoe into college too, as far as like.
What'd you get? You got life for scouting? How far did you go on scouting?
Just leave alone. Like
I got
Whatever.
I was a life scout, but got about 5 merit badges short of Eagle. Got out.
My first Big Tennis match today. It wore me out.
Whoa, did you win?
I did in like 7 days. Natalie's really
Welcome
good.
to the Butler Snow Conference Center.
She like sound like one of the ones like,
She's getting much better.
Thank you. Please stand by.
Do you want
If you are the chairperson, press the star key now. Please enter your chairperson passcode, then press pound.
to cheer?
Your subscription has been set up to require that an account code be entered. Please enter the number now, followed by... You entered 044444. If this is correct, press 1, or to re-enter the code, press... To start your conference, press 1. To change account options, you will now be placed into conference. For a menu of conference commands, press ** at any time.
Rachel, are you on the line?
Hey, I'm here.
Okay.
Wow, we're ready to start early.
Yeah.
It's good. Yeah.
I'm gonna put one of those in front of you. Just gonna pre-give you one of these. Pre-give you one of these.
Is this a pre-give CV2?
Yeah, you
Okay.
can.
I'll just need to play one tomorrow.
Okay. I'm ready whenever you guys are.
Well, hang on. Hold on one second. I was ready.
This your share, is it that for me?
That's for you.
Oh, okay.
One more second. I really was ready. And then I'm just... Okay, ready.
all right, how would you like the video preamble? You want the formal one, or would you like to waive it?
I'm fine with waiving it, Ben. Yeah, why don't you waive it?
All agreed? All right, let me get this started. We are now on the record. Today is the 11th day of August, 2016. Time is approximately 2:58 p.m. This is the videotape deposition of Mr. David Brick. At this time, the witness may be sworn in by the court reporter.
Sir, if you will, please raise your right hand. Do you solemnly swear or affirm the testimony you're about to give in this cause will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Mr. Brick, my name is Danny Van Horn. I think we spoke on the phone maybe a couple of times. I represent Versant Supply Chain in the lawsuit that's been filed by Warren and Tresa Greer. Would you please state your name for the record?
David Martin Brick.
Mr. Brick, where do you... let me go through some deposition basics real quick. Have you ever given a deposition before?
I have.
How many times have you given a deposition?
I've been practicing 30 years, about 27 years just in this area of work hardening, we call it, functional capacity evaluation. So probably at least 30, 40, something like that.
Okay. Have you given a deposition in another matter in, say, the last year?
Yes.
Okay. What I'd like to do very quickly is just make sure that you understand how this is supposed to work. So Mr. Taylor's here, Ms. Hogan is on the line, and any of the lawyers can ask you questions today. And the purpose is for us to be able to ask you questions and for you to be able to give answers to the best of your ability. Do you understand that?
I do.
Do you understand that you're under oath here today just as if you were in court?
I do.
If one of the lawyers, if myself or Mr. Taylor or Ms. Hogan, asks you a question and you don't understand that question, will you ask us to rephrase that question?
Yes.
If you answer the question, is it fair for any one of the three of us to assume that you understood the question?
Yes.
If you want to take a break, you can take a break at any point in time with the understanding that if Mr. Taylor or Ms. Hogan or I have a question pending to you, you need to answer that specific question. Is that fair?
Yes.
A few other sort of real basic things, and that is, you've been doing a great job of this thus far, but you need to give verbal responses, say yes or no. People tend to say uh-huh or uh-uh. We can see your body language, so can the camera that's here. But it'd be helpful if you mean yes, if you say yes, and if you mean no, if you say no. Will you try to do that for us?
Yes, I will.
We need to talk one at a time, and again, you've been doing a great job of that. People in normal human conversation will understand what question's being asked of them, and many times start to answer it before the question's done. But if we could talk one at a time, that'll make a better record for everybody. Will you do that for me?
I will.
And I will commit to you, although I'm sure I will goof this up at some point in time, I will try to not start asking the next question before you finish answering before. So I will commit to you that I will try to not talk over you too, all right?
Yes.
What I want to do briefly is go through your background, explain what it is that you do for a living, your education and your work history, and then talk specifically about the involvement that you had with Warren Greer. So do you understand sort of that basic structure?
Yes, I do.
All right. Would you explain to the jury what it is that you do for a living?
I'm an occupational therapist, registered and licensed. I'm licensed in Tennessee, Arkansas, and Mississippi. I've been practicing this next month for 30 years. I've specialized in the area of work hardening. I work with primarily persons who've been injured on the job, have had some type of injury. Some have been pretty catastrophic. Some are simple strain, sprain type injuries. I evaluate the person. They're referred by physicians if I provide treatment. I can evaluate a person without a physician referral. An attorney could refer, or a workplace or insurance company, but if I provide treatment, I have to have a physician referral. I formulate a treatment plan after a thorough evaluation of the injured person, and then follow a referral script that the physician has laid out and design a program specifically for those problems. Usually that consists of stretching exercises. We teach people body mechanics, proper lifting techniques. We work on strengthening. We have a warehouse here. Half my building is a warehouse, and we try to simulate activities people perform along with evaluation and the work hardening program. We screen persons being hired by various companies, various employers, trucking industry, warehouse industry. We have persons who come and they go through a screening process. They may have a drug test, then they do a thorough physical evaluation, then we do a functional eval where we have them meet some of their job demands, lifting, climbing, demonstrating abilities to function on the job.
All right. But you handed me here today, in response to my request of you, a copy of a resume or a CV. Do you have that in front of you there?
I do.
Is that a true and correct copy of your education and experience through today?
Yes, sir.
All right, let's go ahead and mark that as Exhibit 1. Yeah, that's for you. Let's mark that as Exhibit 1.
Let me mark your copy.
Here, he's got an extra. All right, if I look at your CV or your resume, it looks like you had a degree in physical education from the University of Central Arkansas in 1980, is that correct?
That's correct.
And then it looks like you had a degree in occupational therapy from Central Arkansas in September 1986, is that correct?
That's correct.
All right, the various employments that are listed here, are those the places that you've worked since you got a degree in occupational therapy?
Yes, sir. I started off, I've worked in Memphis all my life. I started off with the old Baptist Hospital, the old Lamar unit they referred to. The building's not there anymore, but on Crump in Lamar, where I I worked on a staff. I did general rehabilitation, worked there for approximately 1.5 years. I met some other therapists and a doctor, and they were interested in going out and establishing one of the first private clinics for therapy in Memphis. And we went out and formed a clinic. We were called the Rehab Clinic of Memphis. I did general rehabilitation there, and then that's where I started into the area of industrial rehabilitation. I met a vocational rehab person and other persons who were starting to get some training in this area, and through my background in anatomy and physiology, I started assisting with the program. Then I took courses and became one of the leaders in the field. I left there and joined a group called Physiotherapy Associates. We were called the Ergoplex, located over on Noncona Boulevard. I established a clinic there, was there for approximately 8 years. Then I started another clinic called Work Solutions. It was on Noncona as well, just down the street from where I was. I was there in the neighborhood of 6 years. I then went out with a partner. We were called Memphis Rehab Center. I continued to do industrial rehabilitation. We were located at the Park Plaza, the shopping area in the corporate building there in the bottom floor. But I did work hardening. I've always done functional capacity evaluations. And then I became joined here with a lady named Denise Higdon, and we were partners in this Worksiteconsultants. We have a location here in Memphis. We also have a location in Jackson, Tennessee. I go over there and do functional capacity evaluations.
Okay. I want you to look now at the document that has your company, your current company's name, Worksite Consultants, and it specifically refers to patient Warren Greer. Do you see that? It's a 2-page document.
Yes, sir.
Can you tell us generally what, we're going to get into the details of the document. Can you tell me generally what is that document?
This is a document that I provided to the physician who had referred Mr. Greer to give a synopsis of his program participation while at my facility. He came for approximately 6 visits, and during that time I evaluated him.
Let me catch you up there, because we're going to get into the details of it here in a minute. When did you create this document? How close in time was it to when Mr. Greer was being seen by you?
It was at the time, at the completion of his program. Then I dictated this report and sent it to the doctor.
Right. Is this type of document something that you regularly or routinely provide to the physicians who refer patients to you?
Yes, I do.
Do you feel like you have a business duty to create a document like this?
Yes, because as a therapist, we're going to evaluate someone, and we're going to give a progress summary or a discharge summary with every patient that comes through the door.
All right, and let's go ahead and mark this as Exhibit 2.
I'll just mark mine.
All right, looking at what would you call Exhibit 2? What would you call that?
This is a evaluation, progress summary, discharge summary, a synopsis of Mr. Greer's performance while at our facility, Worksite Consultants.
All right. It lists in that sort of top block a physician by the name of Jeff Sawyer, a Medplex resident. Who was Dr. Sawyer?
Dr. Sawyer was with Campbell Clinic. They cover the Medplex, and there was I guess a resident assistant who was also involved in the case.
And was there a referral from Dr. Sawyer of Mr. Greer?
Yes.
Right. How was that referral communicated to you? I mean, did Dr. Sawyer literally pick up the phone and call you, or how does that referral typically happen?
Well, the physician does not usually call, but at times they do. You know, if they want to tell me something specifically that they want done, or about a particular patient that they've been treating. But this was arranged through a rehabilitation case manager, a lady named Karen Maggs. She's a registered nurse, and she possibly contacted our office to set this all up, to tell us that we had a referral to treat this gentleman and for what frequency, what duration of time, and then we were to get him scheduled, that's done by my office people. They'll call the patient, get them scheduled to come in and start the program.
And so if Miss Maggs is the one who helped set this up, how do you know it's Dr. Sawyer who made the referral?
Well, I have a sheet in the file here that's got his name saying he's the overseeing physician. for
Okay.
that, but it's got a sheet with his name on it and with a specific time for the patient to come participate.
All right. And when you created Exhibit 2, this report, did you then send it to Dr. Sawyer?
Yes.
All right. Did you also send it to Miss Maggs?
Yes.
All right. Did you ever directly speak with Dr. Sawyer as it relates to Warren Greer?
No.
Okay. Did you speak directly with Miss Maggs about Mr. Warren Greer?
Yes.
Do you recall what you and Miss Maggs discussed when you talked about Warren Greer?
Not specifically.
Do you know whether Miss Maggs attended Mr. Greer's appointments here at Worksite Consultants?
She did not come to the daily program. Sometimes they may either call during the process of the program to see how a person is doing, how many days they've come, something like that. Just check on if they're compliant with the program.
Okay. I want to focus now on what you've written here. All right.
Yes, sir.
It says on the second line, Mr. Greer, was seen for an initial evaluation on December 10th, 2012, right?
Yes, sir.
Do you recall that initial evaluation on December 10th, 2012?
I do. I have notes in my file covering that.
Well, I hadn't seen this, and I suspect that Mr. Taylor hadn't either. Can we don't have to look at the second, but can we make a copy of the file and make that Exhibit 3 to the deposition?
Yes, sir.
Okay. All right. And if you need to turn to your notes to refresh well, first of all, do you independently remember what was discussed with Mr. Greer in that evaluation on initial evaluation on December 10th, 2012?
Well, I have notes reflecting that.
Yeah, I guess my question is, without looking at the notes, could you tell us what the two of you talked about in that initial evaluation?
Well, when he came in, he, as any patient who's referred, completed some paperwork. A lot of it is patient history information, what's happened to them, how they become injured, what do they have any other health problems, they take any medication, standard form. Then we have them fill out some questionnaires regarding pain. Are they having any pain presently? And if so, try to assign a number to it. I use about 3 different questionnaires. I use an anatomical drawing questionnaire, a numeric questionnaire, which is rate your pain on a scale of 0 to 10 plus. Then a McGill questionnaire, which is a lot of word descriptors. He completed those forms. Then we formulate a chart that I have here. We put together a chart, and then I usher the patient back after they complete their questionnaires into the exam room, and then I do a very thorough one-on-one interview, and I ask them a lot of questions. When did you see the doctor? When have you seen them last? When do you go back? Then the mechanism of injury. What happened to you? How did this happen? What was the process you went through? What happened after that? He gave a chronological history of what had happened, what his treatment had been to this point, what surgeries he had had, and then also did a basically kind of like a social history where I asked, what are you involved in day to day? What's a daily routine like for you? Ask them their educational level, and then ask them about their employment. What job had they been doing? What does it entail? Then what is their work history? What other jobs they've done in the past? One thing that stuck out, he had told me he was short-term employed, where he was working at the time he became injured.
Okay. Can you turn to those notes or those the pain questionnaire that Mr. Greer would have filled out?
Yes, sir.
Let's take a look at that real quick. what did the sheet that you're looking at, is that the number rating? In other words, it's a scale of 1 to 10 or 0 to 10 in terms of pain?
That's correct.
And what number, there's a number circled there, was that the number that Mr. Greer circled, or that you circled in response to what he told you?
Mr. Greer circled.
And what
He
number?
filled these out.
What number did he circle on a 0 to 10?
4.
And is 10 the worst pain and 0's no pain?
That's correct.
Okay. And then you said there was a McGill questionnaire,
Yes.
and what does that, again, the circling that's on that particular sheet that you're showing us now, were those Mr. Greer's circles?
Yes.
And what does that in general show you as you look at that?
Well, each word that he circles has a scoring weight, has a number that's assigned to it. You add these numbers up, and that comes up with a calculated score on this particular questionnaire, which in his case he scored a 12, which would be considered to be unremarkable.
Okay.
Based on the literature of this questionnaire.
And then did he have an anatomical drawing that he drew on as well?
Yes.
All right. And the area, I see a circle around the right shoulder.
That's correct.
Are there any other areas circled on the anatomical drawing?
No, sir.
Right. And is that what Mr. Greer circled when he was then sitting with you on December 10th, 2012?
Yeah, he did this out in the waiting area there. They fill out the questionnaires, but he indicated, there's a key here, he indicated stabbing as being his complaint to that area.
And that area is the
Stabbing
right
type
shoulder, the front and back of the right shoulder?
pain. That's correct.
Did he have any circles around the abdomen area?
No, sir.
Okay. If we look back at Exhibit 2, I'm sure we'll flip back and forth between your chart and Exhibit 2. If I look the third paragraph down, seems to me to be the paragraph that focuses on that initial evaluation.
Yes, sir.
So in the third paragraph it says, Mr. Greer presented for initial evaluation on December 10, 2012, wearing a belly binder brace. What's
Yeah.
a belly binder brace?
He had a wrap, just more like an elastic type wrap that wraps around you.
Okay. He did report that he used to have sharp pains to his abdomen, but is now only tender. Is that something that he told you in that initial evaluation?
Yes, sir.
And when it says he did report that he used to, is that Mr. Greer?
That's correct.
Then that third sentence here in that paragraph says, he, Mr. Greer, was able to perform abdominal stretching with good tolerance. Is that something you did with him in a one-on-one evaluation?
What we did during the program that he participated in. Yes, sir.
Okay. That might not necessarily have been that first day. It might have been a subsequent day. Is that what you're telling me?
Yes, sir.
Okay. It then goes on to say he, Mr. Greer, did have complaints to his right shoulder, and the initial measurements displayed 140 degrees for abduction and 130 degrees for flexion. Do you know where those initial measurements came from?
I took them personally.
Okay.
Yes, sir. I had him try to raise his arm up and measured with a goniometer the degrees.
Okay. Was that in that initial evaluation on December 10th?
Yes, sir.
All right. It then says, your report says, he, Mr. Greer, was achieving full range of motion at 180 degrees for each movement while performing stretching and resistive weight activities. Is that at the end of the various daily functions that he did here?
Yes, and during the day, he would come and spend in the neighborhood of 4 hours here. Come, and he came 3 days a week for two weeks. He came 6 visits. I would be talking to him. He'd be out on the mat in the. I have a gym area in here, and so he was on the mat, and I would talk to him while he was working out, while he was stretching. I instructed him in all the program activities, and then also talked with him daily about how he was doing, observed him.
Okay. That third paragraph in Exhibit 2 here, your report, says strength was normal in the 5.5 grade range.
Yes, sir.
Was that at the end of his time working with you, or was that on the day that you did the initial evaluation?
At the end of the time here.
Okay. If we go back up to the second paragraph in your report, it looks to me like maybe that deals more with the various times that Mr. Greer came here. Is that fair?
That's fair. That's correct.
All right, so the second paragraph says, Mr. Greer has been very pleasant and cooperative. Did you find Mr. Greer to be a pleasant and cooperative patient?
Yes, I did.
And in fairness, I think every medical professional we've dealt with has said Mr. Greer was a pleasant and cooperative person. It says Mr. Greer, was instructed in stretching exercises to all body parts, including the upper and lower extremities and trunk. Without getting too much into detail, because I'm sure you could spend a while discussing that, what sort of instruction was that?
Well, each day came the program, and I've got outlined on the sheet, the exercises he performed. He would lie down on the mat and on his back, and he would stretch his upper extremities. I had him do that. He'd also do some in standing. Then I had him do some exercise for his lower back. I mean, he had his diagnosis was things involving the trunk primarily.
Okay. And then this paragraph goes on to say, Mr. Greer, initiated very well after instruction and was independently performing 15 repetitions for each exercise. When you say for each exercise, what are you referring to?
I mean, every exercise I had him do for the arms, for the legs, for the trunk, he was able to meet that number that we had assigned that he would perform. And after instruction, I mean, he would do the exercise. I didn't have to make him do them or force him to do anything. He was very agreeable to working in the program.
Okay. The sheet in Collective Exhibit 3, which are your notes, there's a handwritten chart. Are those the exercises that Mr. Greer did?
Yes, sir.
Okay. Were those the repetitions that Mr. Greer did for each of those exercises? Was that data recorded each day that he was here?
Yes, sir.
Okay, so it's not a deal where at the very end you went and filled in the chart for the 6 days.
No, sir.
Okay.
Every day, any patient when they come, we give them. We have a chart that we help complete. If they can't complete it, we do as we observe them and indicate the number of reps that they're performing and all the activities they're performing.
All right. Again, in this second paragraph of your report, it says Mr. Greer, was walking on the treadmill for 20-minute intervals and riding the stationary bike for 20-minute intervals. How do you know that?
Well, because I was out here with him. I watched him do it. I observed him, recorded these on a daily basis.
Okay.
I did daily notes too as well on
Right.
him. I have them in the chart.
It says he was operating the upper cycle for 10 minutes. What's the upper cycle?
It's a machine that I have that will work your upper body, work your arms. You hold on to it like you're riding a bicycle with your arms.
Okay. It says Mr. Greer, was working with resistive weight machines for lower body strengthening and for his trunk abdominals. Are those, it's not free weights, is it?
No, I have a whole battery of machines out here in my gym area. I have about 15 different machines for all body parts that he would get on. You go like a circuit and perform a number of repetitions and sets on these each time you come. Try to progress on the amount of weight if you can.
Okay, so they're not free weights, but are they weightlifting machines?
Yes, sir. Okay. They're more designed for an injured population because your body is stable while you're isolating on a particular part of your body.
Couple sentences down, it says also Mr. Greer, performed functional activities including climbing stairs, pushing and pulling the sled with 75 pounds, and lifting and carrying 40 pounds for multiple repetitions. I want to take each of those. Do you have stairs that you have someone climb back there, or?
Yes, I have a warehouse back in the back, and I have stairs that go up pretty high that people climb. I have a ladder that attaches to the wall that people climb. I see a lot of heavy duty workers. I see police officers, firemen, linemen for light gas wire. They come and wear their gear out here at some point if they're in the program. So we have a good program to simulate jobs and activities people perform.
Okay. Then it says pushing and pulling the sled with 75 pounds. Describe for the jury what that device looks like, and why do you have someone? Well, just first describe what that looks like, then I'll ask the next question.
Well, it's a standardized piece of equipment, exactly, almost somewhat you could describe it like a football sled on the football field, but you have handles on it, and you can put weight on the device and slide it across the floor. You push it and then pull it, and you have some resistance while you're doing that. He actually progressed, started with 50 pounds when he first started, and worked his way up to 75 pounds for that activity, and then
So my next question is, and I just cut you off, so if you want to give a further answer, please do so.
I think I'm through.
Okay. Why do you have a patient like Mr. Greer use a sled that you push and pull with 50 pounds or 75 pounds on there? What is that supposed to simulate?
Well, helps with strengthening, helps strengthen the upper body, the legs. We're a program. We're the next step beyond regular physical therapy. I mean, a lot of regular therapy, they're going to start with some basic stretches, may have modalities such as heat or ultrasound or ice, but when you come here, we're the next step. We're trying to prepare people for further improvement. Hopefully, if they have a goal of getting back to some level of function, then we're the program designed for that, to measure all these things, to give physicians and persons that information to help make a determination about, where they function, what they can do, how they're performing.
The last part of this second paragraph of Exhibit 2, your report says that Mr. Greer was carrying 40 pounds for multiple repetitions. What would Mr. Greer be doing when he was carrying these 40 pounds?
Well, we have boxes that we use, and we put weight in the boxes. So he progressed from starting with 30 pounds to the 40 pounds. He progressed from doing 10 repetitions with 30 pounds on several days to doing 15 repetitions with 40 pounds.
Okay. But when they're carrying the box, are they walking from spot A to spot B, or are they going up and down stairs? What are they doing?
They're walking across the floor. We have a designated distance that they do, and we're working with them on proper technique, proper positioning.
Okay. The fourth paragraph down now, where it says, it starts with Mr. Greer completed his program on December 19th, 2012. Do you see that?
I do.
All right, where it says Mr. Greer, was slated to be released back to his regular work duties at Lazer Spot, where he was employed for the 3 months before his injury. Where did you get that information that he was employed at Lazer Spot for 3 months prior to his injury?
That's what he told me during the initial interview on the initial evaluation. That's where he worked. Told me some of his duties there.
Okay, and I'm going to get to that in a second. The sentence before that says that Mr. Greer was slated to be released back to his regular work duties. Where did you get that information from, that Mr. Greer was slated to be released back to regular duty?
When he was referred to me from the physician, they had a specific duration and frequency. They wanted him to come 3 times a week for 2 weeks, and at the end of that, they didn't necessarily say they had a return visit scheduled back with him. They said, look, at the end of the program, he can go back to work,
Okay.
And I guess unless he wasn't functioning here, but here he progressed and he was cooperative. He did the program with, minimal complaints.
The last 2 sentences in that fourth paragraph, the one that starts with Mr. Greer was working at Lazer Spot as a local driver and operating the yard mule at the terminal. He reported his duties were climbing into and out of the truck cab and unhooking hoses. Where did you get that information from?
From interviewing him initially, and during the course of time, I talked to him. I spent time with him and talked with him and was out there, talking about day-to-day things or how he's doing.
Okay. There's a paragraph in bold then towards the bottom of the page. Would you read that for the jury?
At this time, Mr. Greer is discharged from the work conditioning program. He was displaying abilities to return back to regular work duties without restrictions.
Was that your opinion as of roughly December 19th, 2012?
Yes, sir. He had progressed in the program by virtue of him pushing and pulling 75 pounds, carrying 40 pounds. The job of a local, like a truck driver, if you're not handling a lot of materials, if you're in and out of the truck, hooking, unhooking, things like that, would be in a medium work range. He was meeting what would be considered in the medium work range by what he did here, how he performed.
Object, move to strike.
Did you discuss this opinion with Mr. Greer? Did you tell him that he was being released or displaying abilities to return to regular work duties without restrictions?
I don't recall specifically in those terms, but he knew what the duration of the program was with the referral. I mean, he did not tell me, well, no, I can't do anything, no, I can't function. I mean, I did not hear those words. He was agreeable, basically. He came in, cooperated, minimal complaints. I mean, he did not have a lot of complaints here. He talked positive about the program in general, you know, what he was being asked to do, and felt like it was beneficial to him.
Okay. Do you know whether a copy of this Worksiteconsultants report was ever sent to Mr. Greer?
I don't know. A patient can have access to their report, though. I don't know if he requested that, but generally, or they may can get it through the case manager. Sometimes physician's office, you know, has been known to provide it, or whoever's over the case could provide it to them.
Okay. Now, you were describing a truck driver's job, if they're not having to handle materials, as medium duty. Where do you get that information from?
There's a literature put out, but there's a book, the Dictionary of Occupational Titles. They put out very conclusive information about everyone's any job that there is. They list it and they tell what the duties are, and they classify it in a work range. Most jobs are classified in ranges such as sedentary, which would be lifting under 10 pounds, sitting.
A lawyer. A lawyer be sedentary.
You carry a briefcase probably, so that might. But anyway, sedentary work. Then light work would be lifting up to 25 pounds on an occasional basis. There's a light medium category, which would be somewhere between light and medium, would be probably from 25 pounds to 40 pound range, and then in medium work would be in the 50 pound range. That's like the maximum you're required to handle on a job.
Okay.
Object, move to strike, lack of foundation.
Well, that's why I'm asking these questions. So let me delve into that a little further. As part of your education at Central Arkansas with a degree in physical therapy, did you study these types of classifications of workers and their work ranges?
I'm an occupational therapist, but in school, you know, this was a new field coming out. This is a field that basically was starting to create. As I started practicing, I went to courses. I've been to courses all over the country and specialized strictly in this area. Once I got involved in this, I went to see the front runners of this profession who had begun a good thorough testing process, because I wanted to learn, I wanted to be the best, and I studied under them, went to courses. Then I've delved into it. Part of my continuing education has been solely just in this area. I've worked with back injuries, neck, shoulder, musculoskeletal injuries, and then plus the functional aspect, how to measure these things. We go into detail measuring a lot of physiology type things, really what's called for, but there are standards out there nationwide, or everybody who is in this field would prescribe to the work ranges. Number one, every job is classified in a work range, and that's the guidelines physicians would use, therapists utilize. That's the only objective way to try to give some measurement to it.
What did you say the name of that book was? Oh, go ahead.
Object, move to strike, foundation, unresponsive.
What did you say the name of the book was?
There's a book called the Dictionary of Occupational Titles that describes every job there is, and it will tell what the job demands are. Now, sometimes there could be some variations. I at times will try to get a job description from the employer. If we're unsure about a job, we go out and look at jobs. We help persons create job descriptions if they don't have one. We go out and actually measure what's required of the job. How much do they stand during the day? What positions are they in? How much is required to lift to do this job? We measure these things and help create job descriptions as well. I've taught on the subject. I've taught at the University of Tennessee. I was on the board for 8 years at the University of Tennessee, the admissions board, and I've totally taught in this area. I've gone and spoke at seminars to the Tennessee Health and Safety Congress over in Nashville. I've gone about 3 years to do that and talk specifically on this area that I practice in.
Same objection.
The dictionary that you described, do you consider that to be an authoritative work in your field?
Yes, sir. Any therapist that does what I'm doing, they would, if they know what they're doing very good, they're going to refer to this. Yes, sir.
Okay. Pass the witness.
Can we take just a 1 minute break?
Yeah.
All right, going off the record, time is 3:37 p.m.
Sorry, I just need to stretch this.
Y'all need a
chair.
restroom or anything like
No, no,
that?
no, no. You can just give
We've
me
got a
one.
restroom down the hall if you need one.
Okay, we're back on the record. You passed the witness.
All
Yep.
right, Counselor, can I get you to put a microphone on?
Oh, sure. You know, I had it on earlier. Apologize.
Well, you didn't say much. You're okay. That's
Much-
just
much-
form non-responsive.
Much,
All right, let me announce the time real quick and we'll be back on the record. We are now back on the record. The time is 3:49 p.m.
Mr. Britt, my name is Ben Taylor. You and I have just met. I've never had the pleasure of meeting you before. And I represent Warren and Greer and his wife, Tresa, in their lawsuit as a result of this accident. I guess let me start out by, do you know what happened? Do you know?
Other than what he told me, he said he was opening up a trailer door and some equipment fell out on him.
Okay.
Yes.
Okay. And were you aware of his treatment up until he saw you? Do you know everything he went through?
What he reported, yeah.
Okay. And what was that? Do you remember? I know you said earlier you spent quite a bit of time with him.
I did. Yes, I sat down with him in the treatment room. I wrote all these notes from talking to him that he told me the injury was on December 22nd of 2011, and that he was opening doors on a tractor trailer vehicle and a large piece of equipment fell on him. An ambulance and paramedics came. They took him to the med. He said he had 6 rib fractures, lacerated liver, perforated lungs, treated in the ICU. Then he was moved to a floor. Said he was discharged from the med on January of 2012. And then he said he had a surgery for his lungs on March 23rd of 2012. And then he had a hernia repair surgery on June 26, 2012 with a skin graft. He rested, had some doctor visits, said he was took some pain medications, but doesn't take them anymore. He complained of right shoulder pain, stiffness. He'd been participating in physical therapy at Omega Rehab there, that he had lost some weight. Said he'd initially weighed 223 pounds and he lost down to 165 while he was at the med, but said he now gained it back to 211 pounds. Then told me about some previous history. In 1985, had a motorcycle accident with a right lower extremity fracture, amputated right small finger.
Okay. And those are all your notes. Is that your handwriting there?
Yes, sir, it is.
And what document is that? Is it titled or?
Yeah, it's just an intake form, just a patient history form.
Okay, and that's what I mean is when the
And-
jury sees the letter, like if they look at the top,
A
it says
subjective interview.
subjective interview at the top. Okay.
Yes, sir.
And all that handwriting is all yours.
That's correct, and then I use that to help with my reporting that I did.
Okay. Now, is that considered part of your medical records?
Yes, sir, that I did from the patient. Mhm.
Okay. And the reason I ask is my office, and see the letter, I think it's in there, it's part of the file. We requested a copy of all of his medical records. And what we received from you was just this report that's been marked as Exhibit 2. And I was just going to ask you, I mean, is that just an oversight, or I mean, is there a reason?
I don't know, my office person, I guess, just sends out the report usually, sometimes. You may have requested more, I don't know, wish you had called or something.
Okay. Well, and that's the thing, we don't, in my business, I mean, I don't anticipate that someone's not going to provide us with something that
I
we
got
request for. In fact, let me see what the letter is in here. I want to make sure that we did ask for it. Yeah, all medical records for date of service, December 10th, 2012 to December 21st, 2012. That's
Yeah, I have a office person that usually sends out everything. I don't know why.
okay.
I'm just now seeing that too.
If it makes you feel any better, we're in exactly the same boat.
Okay. Now, did Mr. Greer tell you what he did for a living?
Well, at that time, he told me he was working for this Lazer Spot company and said he was a driver, but he described driving a yard mule, climbing in and out, unhooking hoses, empty moved loads, what he said.
Okay. And I guess my question, do you know what's involved in climbing into and out of a truck? I guess, do you know what kind of truck he was driving?
Well, some of these are different on different yards, but like almost like a truck cab or a half a truck cab, that type of vehicle. Yeah, I've been out on numerous yards. That's part of what I do, and I've climbed in and out of them myself. I've hooked and unhooked hoses. I've dollied down a trailer.
And so we're clear, you're talking about like a tractor trailer semi, like 18-wheeler tractor, right?
Well, yeah, there are variations of it, but yes.
Okay. And what did he do here for, I guess, work conditioning that got him, you said that he was prepared to go back to work. What was it that he was doing that would prepare him to get into and out of a cab?
Well, we did a lot of climbing of stairs. He walked on the treadmill, rode the bike, things that work his legs to help strengthen him, and that kind of thing. He, and I observed him as he was climbing. The pushing and pulling the sled we described earlier would help strengthen his legs to help prepare for people that do a lot of walking, do a lot of climbing activities, work
Okay.
with some weight machines.
Okay. But he doesn't, run for a living, does he? He doesn't ride a bike for a living.
No. But these are all activities that help with your endurance. I mean, this would be standard things. Like if you're an athlete, you don't ride a bike for a living for that either. You play football, but you do some things to get your legs in shape. You look at Peyton Manning and them on the sidelines. They're riding a bike on the sidelines. What's that all about? But that's to help. They're getting keeping their legs warm, keeping that blood flowing. Trying to stay loose. I mean, those are all lead up things to work on various tasks.
Okay. Now, I guess you've said here in your report that he was displaying abilities to return back to regular work duties. Did you actually go out to a tractor trailer with him and see if he could get into or out of the cab?
Well, I didn't, but I mean, I watched him. I watched him climb. I didn't see any difficulty with his pattern. I mean, he had good rhythmical pattern. I didn't make notations that he was limping or having any trouble such as that. I mean, I've had a facility where I actually had a truck cab in my clinic. I don't hear, but we have them climb and do some tasks to, it's the movements. I mean, it's the movements you get people to do that would be similar to movements they make out on the job.
Now, you said we. Do you mean, is this you that is doing all these exercises with Mr. Greer, or are there other people doing it?
Well, I have a technician. I don't know. I had a different person at that time, but I have another therapist, Denise Higdon, who works with me too. You know, she might come in and see a patient as well. But I did all the documentation. I mean, I did all the hands-on work with this gentleman.
Well, tell the jury, if you would, what kind of documentation is it that you do? I think you testified earlier. You did some measurements.
Yes, and then I do daily notes of what their program consists of. I have chart of what he actually performed, but I have all the daily notes that I generated at the time that he was performing these to tell you each day, you know, what he did. You know, this first day was like an initial eval, and I wrote down the measurements that I took, measuring him, you know, just different body parts. Then the second day, we came in and started him in the program, instructed him as to what he was going to be doing each day, got him on the various tasks. Then it's a progressive program, you know. Then the day
Let me stop
3,
before you go any further. Again, you say we, and I don't know if colloquially you're saying that, but are you saying that every day he came in, you were the one that did this, or do you have therapists that work with your patients, or what?
Well, I have a technician usually that observes people too, in case I get a phone call or something. But I pride myself on spending the time with people. That's the whole. That's why I'm a preferred person with this in this town, because I go the extra step. I'm gonna try to spend the time with people. I'm gonna try to talk to them. You know, I'm gonna try to sit down with them and treat them as a human being. I mean, really, I have a lot of passion for what I do, and I enjoy what I do, and I like it when people can get back to function if that's their goal, you know.
And is that I guess the goal here? And by that the doctors, do they look at your reports, and do they use your findings to determine whether or not someone is able to go back to work?
A lot of doctors rely on the information I provide. Some may use it in different manners. I don't know all of them, but I have people, and they want me to do it. They say, look, we feel like you've been a reliable provider for a number of years, and they're looking to me to make a determination. They know I will go the extra mile. I will go to a job if it's something I'm not familiar with. I'm going to make a bunch of phone calls to people's workplace and go out to the job if I need to. But I felt like in this case, I knew what he was doing, and I mean he didn't. Gosh, he was very pleasant. He did not rebut me or get ugly with me one day, anytime. I mean he was talking positive about everything we did here.
I agree with you. He and his wife are both very nice people.
Yes, sir.
But getting back to what I was saying, in this particular case, did you send your report on to, was it the Med? Is that where you said he was referred from?
Yes. I sent the report. This is mainly to Dr. Sawyer here. He was in charge of the case.
And that's what I was looking through your file, and I don't see Dr. Sawyer referenced. I see another doctor referenced from the Medplex, and
I've got it in here on this page. On this page, let's see here.
right, that doctor right there.
Yeah, but she's
who is that? What's that name?
You know, I don't know her. It seems like she's a resident there. It's got on this sheet under resident MD. It's got her name, and then referring attending physician. You know, hard to read that writing, but that's Sawyer, S-A-W-Y-E-R.
Well, did you get anything from Sawyer? I guess that's because we have records. We have all of Mr. Greer's records.
From Dr. Sawyer?
Well, that's just it.
Oh.
That's why I'm wanting to know where Sawyer referred him to you. Do you have documentation with Dr. Sawyer's name and or signature on it, referring him to you, or even saying that he's been treating Mr. Greer?
Other than the document he just described for you?
No, I mean, show me the document that you're talking about has another it's a resident physician.
Well, no, I don't want the record to be confused. He pointed specifically to the physician's name on a document from the med.
Oh, okay. All right, so and we'll just hold it up so the video camera can see. It's kind of a dark form. Do you know where you got that form from?
Was sent over probably when they sent some other information referring the gentleman. We have to have a referral to treat somebody. We can't just treat somebody if we don't have a accurate referral.
Okay. And so where is that referral?
Right here, and it's got on here requested like therapy, okay, evaluation, exercise program, but then it's got what he was referred here for, the work conditioning program, 3 times per week for 2 weeks.
Okay. And then that was signed by this other physician, though. This can you read her hand? Is it Andrea Papa? Is that right?
Well, the Campbell Clinic, they have all these residents go through there. I mean, you see all kind of names on some of these. I'll see some surgical reports, and they'll have Dr. So-and-so's attending physician, but resident so-and-so may have been in there doing some of the surgery. I mean, I guess that's all under their guidelines, but I don't know this person. I know of Jeff Sawyer, don't know him personally, but I've seen his name on things before, and he's had some other patients here, not a lot, but through the years.
Okay. And yeah, you mentioned Campbell Clinic, and they're a very reputable physicians group. Do you know why Mr. Greer, with an abdominal injury and a liver that was torn in half, would be seeing an orthopedic?
I don't know.
Do you see what I'm saying?
Yeah.
Does that make a lot of sense?
Yeah, I do. I don't know. I don't guess I questioned. That's probably not for me to question. You know, if they tell me, yeah, that's who I'm seeing, or that's, you know, I don't have any reason to doubt this is a valid referral. I mean, that's what I'm going on.
Well, and the reason I ask, I'm going to show you this document. And I looked through your file. I didn't see it in your file, but it's a progress report from Care Management Consultants. Are you familiar with them?
I know the name. I don't know all about them, but I know I deal with part of what we do, or well, within these doctors too. You're dealing with people that are case managers for these companies, and they work for a variety of companies there.
Sure, and that's
yes.
that's what I'm getting at. If you look right here, you see this was submitted by Karen Maggs. So this Care Management Consultants is Karen Maggs, and if you look, the treatment plan down there, it's got a physician, Ben Zarzar, MD, and the date on there, it looks like it's June 13th of 2012. You see that?
Yes.
And the last paragraph, or the last sentence he has, we will have him no lifting for 6 weeks, and then 6 to 9 months before full duty. And I'm not very good at math, but my math, figuring that up, he would have been well past December 10th, 2012, before he would have been able to go back to work.
I object to the form of the question.
I don't know really if there was a question there. I guess if you would have known that he had a doctor at the med that had him off work and basically was not saying he could do anything, would you have allowed him to do all of this stuff?
Well,
Hang on, before you answer that question. I object to the form of the question. I think I don't want to coach the witness. I just think there are pertinent facts that are missing, and then you go ahead and answer the question.
No, normally I wouldn't. I'd use I use a real common sense approach. If I had seen anything out of the ordinary with this guy, I wouldn't have had it. I would have said, look, he's not appropriate for this program. I just didn't see anything that tell me that. When I saw him, he just, I mean, all his vital signs are normal. He was agreeable. He came in. If I saw him struggling or something, yeah, I would have. Or if he said, look, my stomach's hurting me bad, I'm seeing another doctor or something. I mean, I didn't hear those kind of things from her. I would stop the program and I'd say, look, what's going on here? I would have called. I didn't see any reason, because I deal with this doctor. I mean, I've dealt with Campbell Clinic. They had their own therapy, but but I do get referrals from them, and I just didn't see anything out of the ordinary.
And that's the other thing I guess I had a question about. Did he actually, were you referred? Was there a specific referral for you, or who set up this appointment?
Well, there is a referral here from the doctor. I mean, this is a document from
Mr.
Regional
Britt,
Medical
if I could
Center.
stop, you're going to need to answer the question. And my question is, were you specifically mentioned? Did they say, send him to go see David Brick, or did they just give a general treatment plan?
I mean, I don't know that they said specifically me. I don't know how that got generated that way.
You agree with me, Campbell Clinic Orthopedics, they have their own physical therapy department, correct?
Yeah, but
Okay, now, just,
okay.
Now, in your records here, it says, who called to set up the appointment? Who called to set up the appointment?
Karen Maggs, the case manager.
Okay, this is case manager.
Yeah.
It's true, that's who you primarily deal with, is case managers.
Well, they're the ones we said earlier that they're the ones that will get on the phone, and I mean that's the method. I mean, I didn't create it. That's the method I evolved into. I wish the doctor would call, but they don't. You know, but
Well,
this is how everybody gets referral in these physical therapy departments. I mean, unless Campbell Clinic has their own physical therapy, but I don't know how
Which
much
they
communication.
do.
Okay, yeah, they do, but I don't know how much communication they have with their people. But most of the rest of us, any doctors that get referrals, it may be a case manager who calls and sets it up with the doctor's office to begin with. You know, that's just the way it works now.
Mr. Brick, do you do a lot of advertising?
No,
And I was curious about that because I don't see where you advertise at all. It's true that the majority of your business comes from work injuries and companies that send people to you for evaluations. Is that right?
well, I've been a steady practitioner for a lot of years. I've had a lot of other people in this town come and go, you know, but
Hey, Mr. Brick, just yes or no.
What's the question? I'm sorry.
Read it back.
I'm sorry.
Please.
Well, I was curious about that. I don't see where you advertise at all. It's true your business comes from work injuries and companies that send people to you for evaluations. Is that right?
Yeah, physicians refer. Yes.
Mr. Brick, again, would you again read the question back to me?
Ben, let me see if I can help.
No, I don't, there's nothing you need
Your
to say.
question's compound.
The
so I'm gonna
doctors
check
do
your
not
question is
refer,
compound.
okay, the doctors do not refer these people to you.
Well,
It
they
is
do.
the companies and their case managers and insurance
Yeah.
adjusters that refer them to you. Isn't that correct?
I got about 40 different doctors that send me a patient and they call me and they send it. They request me. I see a bunch of referrals, maybe not on this one, but I've got a ton of others that say, we want David Brick, we want Worksiteconsultants, we want them to go there.
Okay, and
We-
and there's
all the
specific
time.
referrals.
Well, yeah, they
What-
call, their office calls, the doctor's office calls to set it up. I mean, then they do it through the case manager. I mean, it's a variety of ways, but,
Now, wait a minute, you said they do it through the case manager. You're saying the doctor's office is going to have the case manager contact you, or the case manager contacts you?
well, like Campbell Clinic has a lot of internal case management people. They will contact us up and send us information. I mean, that's what they do. It's really, I bet this Lazer Spot don't even know anything about me or I exist. I've never dealt with them that I know about. I don't know who they are really. I mean, I don't know them as a company. Now, I might know Light, Gas, and Water because I see a lot of those workers, you know, or City of Memphis. I see FedEx. I see, but I don't Lazer Spot. I don't know anything really about them.
Okay, and I understand that.
Yeah,
What
yeah.
about the insurance company? Who paid the bill?
Well, they didn't pay all of it if you look at that, you know, and I'd like you to help me with that or somebody if you could. I'd like a little more money off that if you can do that.
Great American Insurance Company? Great American Alliance?
Yeah.
They sent you-
Who's going to pay any bill that we got? Hey, who's paying your bill?
Okay.
Who's going to pay your bill? Great American Insurance Company? Great American Alliance? I mean, it's all, who's paying a doctor bill? Everybody, you know, that's not uncommon.
So what part of the bill did they not pay?
I don't know, I'm just kind of talking a little bit, but I
Well,
don't think they
Mr.
paid
Mr.
full, they didn't pay full amount.
Mr.
for
Brick,
our
you're
service.
under oath here
Oh,
today. You
okay,
understand
yeah,
that?
I do understand that part.
Hold on, both of you.
Okay.
Okay.
Pause between questions and answers.
And you understand you need to tell the truth
Yeah.
as we sit here. It's just like we're in court.
Yeah, I'm a man like you. I do. I understand that, and that's what I'm trying to do, and that's what I think I've done to this point, and I'm doing it now.
We'll see about that.
Well, okay.
Now, I'm looking here at, it looks like billing from your company. It's $856.57, and then here's the check for $856.57.
Okay.
And then there's another bill for $1,360.80.
Okay.
And then here's a check for $1,360.80.
Okay.
So I mean, are you still saying here under oath that you didn't get paid in full?
I don't know. I'd have to look at that a little more.
Okay,
I'd have
well,
to examine that.
Well, let's look at it.
Okay. Okay, I'll say we did then.
Okay. There are also forms in here, in your file, that are, looks like they're state of Tennessee forms. Is that something that you sent in to the state?
They sent that to us, and then I just signed it, and we would send some records out per whatever they requested.
Okay. And so what do they normally request? Don't they request everything?
I don't know what we send them. You know, I mean, I have office people that do that.
Mr.
But
Brick, I didn't ask you that.
I send them the report at least. I know that much.
Okay. But you agree with me, they asked for the records. Just like my office did.
Yes.
Okay. And again,
We generally would not probably send them a lot of handwritten stuff I have. We probably just send them the main report.
and why not?
Usually that's all they're interested in doing. That's been my dealings with them through the years. Or we don't hear anything back from them. I never hear anything back from them.
Okay. And then it looks like you billed them, how much did you bill them?
Says $20. That's what they offer up to pay. We will pay $20, but can you find that in my chart?
Okay. And then I guess the question I got now is why you charged my office $30 for the same thing?
I guess if you had said $20, I don't know. That's what they say they pay, government stuff.
Okay.
I don't know.
Let's make sure we don't get that what you're handing him mixed up with his file.
Sure. Let's go ahead and we'll mark that as the next exhibit and then I'll put it down.
So that'll be 4.
We off the record? Or we on?
No, we're still on the record.
Oh, okay.
Oh, I'm ready. Go ahead. Were you waiting on me?
Those are the records, right? I'm just trying to figure out why you're putting that sticker on
Just take
there.
it
I told
off.
you I'm slow. Okay, Mr. Brick, I'm looking at, it looks like a fax cover sheet. It's labeled Worksiteconsultants. Is that your handwriting?
Yes, sir, it is.
Okay, and what is that? Describe to the jury what that is.
When I faxed a report to this Miss Karen Maggs
Okay.
after I
And,
completed seeing him.
okay, and read, if you would, to the jury what's in the comments there.
Work conditioning, evaluation progress, discharge for Warren Greer. This is progress report from Mr. Greer. Please forward this along if Medplex doctor needs to see this. Thank you for working with us.
Now, you said if the Medplex doctor needs to see this, now, what's Medplex?
Well, that's a facility over at the Med where Campbell Clinic doctors cover it.
Okay, now you're saying Campbell Clinic doctors cover it. Why would you not send it to Campbell Clinic?
Because probably in this case, the Medplex is probably like a maze. You don't even know who you're sending it to or anything. Sometimes it's better if somebody else got a connection and been over there, they can either take it to the doctor, make sure it gets there on time, because if I send it to Campbell Clinic, usually I have some fax numbers that I can send it to, or an internal case manager who I know will get the report to the doctor. But over the Medplex, sometimes, like dealing with the VA, you don't know who's getting what, you know.
So your testimony is sometimes it's better not to use the usual channels. You use, would you say back channels, people that you know?
Object to the form of the question.
No, those are usually the channels. Those channels are the people that work in those offices who get stuff to the doctor and get a hold of the doctor if you need something. Yeah,
Okay.
they're not it's not a back door or anything. It's the channel preferred that you would use.
Okay. So rather than on the fax cover sheet saying Dr. Jeffrey Sawyer, MD, Campbell Clinic, attached is a report I did for your patient or our patient. Thank you for the referral. You didn't do that. You sent it to Karen Maggs, who is the nurse case manager for the insurance company, right?
You know, at the time, of course, looking at it today, I'd say, yeah, why didn't I do that? But at the time, I just didn't see anything with this guy. I mean, he came in, he cooperated, he participated, pleasant, cooperative, no complaints, significantly nothing out of the ordinary. I just didn't see anything to concern me with him. I mean, I knew his injuries, I knew that, I knew what he'd been through, but I just didn't see anything. I was kind of surprised, like I'm even here doing this, because I look at this, to me, there's nothing there. It's just pretty self-explanatory. A man came in here, he was cooperative, he participated, he progressed, he did what was asked of him, he cooperated, he tolerated well, he initiated well. I just didn't see anything, to be honest with you. I work with a lot of patients. I didn't see anything. I thought this was pretty much, hey, he came in, he did what was asked of him, and that's that.
You're not a doctor and can't make diagnosis or prognosis with regards to patients, can you?
That's correct.
You can't prescribe medicines.
That's correct.
You're not a vocational rehab expert.
That's correct.
Okay. And so what you do is basically measure people physically. See
Yeah,
what they
I
can
provide
do, what they
objective data, yes. Nobody else does that. I do that. Doctors don't do it. I do it. They don't do it. They don't measure people function, you know. They do what they do, diagnosing and that kind of thing. Then they send to me for the other information.
Okay. And so it's important as an occupational therapist that you're honest and fair and impartial.
Yes.
Okay. It's important that basically you tell the truth, because these are people's lives, I guess we're talking about,
Yes,
right?
sir. Yes, sir.
Okay. Mr. Brick, on August 31st, 2004, you were disciplined for acts of fraud, deceit, unprofessional, and unethical conduct in your practice of occupational therapy by the Tennessee Board of Occupational and Physical Therapy Examiners. Is that correct?
Yeah, and what is all that? What do you think that is?
I asked the questions here, Mr.
Oh,
Brick.
okay.
It's
Okay.
true that you were publicly censured and found guilty of fraud. Is that
And what
right?
did they do to me? I mean, let me tell you.
Again, Mr. Brick, I'm asking the
Okay,
questions.
but I'm going to talk now if you want me to talk. I had a physical therapy assistant that worked for us in our facility. I had a physical therapist there. She worked under the physical therapist, but she also helped with the work hardening program. I was at another facility at the time. That's really what that's all about. It's about that, saying I supervised this person, and they end up putting me on probation. I never quit practicing. They never said, hey, you cannot practice, you're not. They told me, you're fine, you keep practicing. I paid a fine. I did 50 hours of continuing education that they'd asked me to do, and that was that. I never had another issue. Nobody came and supervised me. Nobody came and called me and checked on me or anything. And then dealing with the state, they don't communicate with you. In other words, they don't give you any real instructions. But I did what they asked me to do. Paid a fine and never quit practicing. I'm in good standing. I'm in good standing when I saw this gentleman here. I'm licensed. I've been licensed the whole time. Never had my license suspended. Is on unsupervised probation. I'm sorry, unsupervised probation.
Did you notify the states of Arkansas and Mississippi about your probation in Tennessee?
I don't know. I've been licensed in those states. They've never.
Mr. Britt, that's not what I asked you. I asked you if when you were basically punished by the state of Tennessee, did you contact Arkansas and Mississippi and let them know that your license in Tennessee, that you were on probation?
I mean, I don't know if I did. I probably didn't. Wasn't an issue with anything.
What do you mean it wasn't an issue? The question is whether or not you notified those states. You're aware you're supposed to do that.
Well, yeah, and I've been licensed every year with those states.
Okay, and that's not what I asked you.
Oh, okay,
I asked you,
okay.
when you've been
Okay.
punished in one state and had your license basically had findings of fact, let's see. The first was you were found guilty of unprofessional, dishonorable, or unethical conduct in violation of Tennessee Code Annotated 6313-2091. You were also found guilty of fraud or deceit in the licensee's practice in violation of Tennessee Code Annotated 6313-2093. And then also conducting practice so as to permit, directly or indirectly, an unlicensed person to perform services or work which under provisions of this part can be done legally only by persons licensed to practice.
Everybody involved was licensed people. Everybody was involved. There was no talking to these people. Let me tell you, I got an attorney to represent me. He wrote some letters. I saw where that was going. He said, look, he had talked to somebody there. They want you to do this. He said, they're enacting some ethical laws, which they did. The state of state of Tennessee did. I was not knowing that, but they came out with every therapist takes ethics course, which he said they want to use you as an example. He said they kind of see this, and he said, you can fight it, but they said they're going to do something to you anyway. They didn't want me coming over there. I tried calling their attorney. They wouldn't talk to me. That's before I even had anybody. They would not talk to me. Probation person, nobody wanted to let me come over and have a day to speak with them about any of this. They wanted me to go away, take the deal, pay the fine, do the stuff. That's it. They wrote a lot of nasty things, but they can't tell me what I did, other than I supervised a lady who was licensed, a physical therapy assistant, who shared an office with a physical therapist.
Okay, well,
there's people who practice a lot worse than I do.
Mr. Britt, we could be here all
Well,
night.
yeah.
Okay,
If you want to talk about this, I'll be here.
Both of you, let him
Okay.
ask his questions.
Okay.
Let him finish his response.
If you'll answer my questions, this will go a lot
Well,
faster.
I'm going to answer them. But
Okay. Are you familiar with that document there?
yes, sir, I am.
And if you'll flip through it, is that your signature that you signed?
It is. I signed. I did. I signed it.
Okay, I'm going to make that the next.
But sometimes you sign something with a gun to your head too. It's not the right thing to do, but it's the only thing you can do to get over something. You know that. You practice law. You know, you see a lot of unfair things happen to a lot of good people. Well, I consider myself one of those people. Something unfair happened to me, nobody would listen to me, and they still won't. They will not return your call. Guess what? Everybody involved in this case with the state of Tennessee, they're all gone. Everybody after my deal, the attorney for them no longer works there. Okay, how do you explain that? Leaves the state job. Then the disciplinary coordinator is gone too right after that, and they don't want to talk to me about any of that. There were problems, you know. A lot of people more than me had problems with them. They will not return your calls. If I called over there, I was actually off the probation in 2007, but it was 2009. I decided I wasn't going to call them anymore. I'd called them enough, and nobody would return my call. They couldn't tell me who was involved. And finally, one afternoon, on a Friday afternoon at 4:30, somebody calls my office and says, "Hey, we want to talk to you." And they want to talk to me.
I'd like to stop you.
Okay.
I know, I've read all your other depositions. You've said this before.
Oh,
I'm
okay,
aware of it.
okay. But nobody
Okay,
here knows.
Okay.
I need to mark
Mark this as the next exhibit.
Okay.
Please.
Nobody talk. This will be exhibit 5.
I'm trying to help you.
I appreciate it. Okay. Go ahead.
Mr. Brick, as part of that discipline, you had to complete 50 hours of continuing education, pay $2,000 in civil penalties and all costs. Did you do all of that?
I did.
Mr. Brick, are you familiar with Betty Frost?
Betty Frost. I don't recall.
I'll hand you this document. I'm sorry, Danny, it's the only copy I got.
Look at her.
Excuse me. I'm not familiar. I mean, I can read this report.
Okay, now what I've handed you is that's your report, is it not?
Yes, sir.
Okay, and that's for Betty Frost. After you rendered that report, did you hear anything else about her injuries or her case or anything?
Not to my knowledge.
You're not aware of the United States District Court, Southern District of Illinois, entering an order finding that your opinions that you had crossed the line and that you had exceeded the limits of your field of expertise in your opinions in regards to that report?
When was this now? What did I go to court on that or something?
That's what I'm asking you.
No.
I'm just asking you if you were aware that looks like the order was entered in 2007.
I'm not aware of that, but as you know, people don't say anything about you. What can you do? Who is that? Who wrote that?
This was the federal judge in, looks like Illinois.
You said Indiana before. Was it Indiana or Illinois?
Hang on. No, I'm sorry if I said it, Indiana. It's the Southern District of Illinois.
Okay. Maybe I heard wrong too.
And it's the Westlaw sites, 2007 WL 420152,
Give me that again.
2007
Yeah.
Westlaw
Yep.
420152.
Thank you. Hang on, I think he's asking for, are you asking for a break?
Yeah,
Sure,
just a second.
yeah.
I wonder if I can have a copy of that when you
Sure.
get it done here. I'd like to say, I've never seen that
Hang on a
document.
sec.
Going off the record, time is 4:32 p.m.
Yeah, if you pull that out, you gonna keep it out? Keep that out here, wait. I'm gonna look at that. I've never seen that document.
We'll cut this off so that.
All right, everybody ready?
Yep.
Ready?
All right, let me announce the time real quick. We are now back on the record. Time is 4:33 p.m.
Brick, looking at the, this
Microphone, Counselor.
Oh, I'm sorry. The order that was entered by the Tennessee Department of Health, the facts of that case, it says that you were treating a patient and that you saw them on certain dates and you were the one, I guess, treating them, watching them do the exercises and filling out the forms and everything, much like what you testified to today that you did with Mr. Greer. I think you said you spent lots of time with him and you really got to know him, and that was a really important part of your business and that's something you always do. Now, isn't it true that in this particular case, that's why you were disciplined, was because someone else did all of those things and you didn't?
No, the primary reason was they said I supervised a physical therapy assistant. I don't know what they wrote there, but that's the whole gist of it, that I, as an occupational therapist, but we were doing a work hardening program, which if you look around, there are a lot of disciplines that work in a work hardening program. You know, I just happen to be an occupational therapist, but there are other people you could say, are they qualified or not? But
Mr. Brick, I apologize, my camera ran out of tape.
Hold on.
Hang on, he's got to read this back on.
All right, I'll let you get your microphone and I have to announce the time real quick. We are now back on the record. The time is 4:38 p.m.
Again, Mr. Brick, I apologize, my camera ran out of tape, and so I'm just going to go back to what I was getting at. You said that it had to do with, this discipline had to do with your monitoring someone, but you signed this order, and it says that that you permitted, the respondent permitted the physical therapist assistant to conduct the final evaluation of the patient in his absence. The physical therapist assistant was allowed to take measurements and conduct an assessment of the patient for the purpose of completing the final evaluation. And is that not what I guess what you testified to today? This is all stuff that you did for Mr. Greer?
well, I did, because I watch what I do now. I realize I could be under a microscope, so I corrected all the things that were in this. If there were questions about it, we corrected it immediately. We wanted to practice the best. We were practicing the best, and all this stems from a work hardening patient that I had in the program. His wife was a physical therapy assistant.
Again,
No.
I've read all this.
Well,
So
you haven't read
there's-
that.
there's no need
That's not
for-
in there.
Hey,
That's
y'all
not in
can't-
there.
Can't do
Okay.
that.
That's not even in there.
You don't-
What-
Hold
but I'm
on,
a-
guys. You both have to pause, let one talk at a time. I understand, but Mr. Brick, with respect, if the lawyer is objecting, let him object, and then you can make a statement, and then he can move to strike it. But everybody's got to talk one at a time.
Mr. Brick, again, I ask questions, you answer them, it's that simple, okay?
Well, with all due respect, he can answer it. If you don't like his answer, you can move to strike part of it. but I don't think you're allowed to cut them off.
Okay. Mr. Brigg, you were found guilty of fraud or deceit in your practice
I
by the
hadn't,
Tennessee Board of Licensure, correct? Yes or no?
that's what they say. But I had no due process. I mean, I'm gonna just tell you, there was no day in court for me. There was no day in front of anybody for me. It was all what they wrote, and I had the option to pay a couple $1,000s, do that, or I could pay the $100,000 getting represented and try to go in front of somebody, and then it would have turned out maybe worse if that's what they're saying. I don't know. They didn't want me doing all that. They did not want me to come over and talk to them. They did not want to talk about. Tennessee had no regulations on the work hardening program at all. Still don't, that I know about. There's nothing in writing. I'm doing a work hardening program, which nationwide we helped start. We were one of the front runners of this in Memphis. I was one of the first programs in Memphis doing this. They had no regulations on it. I worked around people who had been on the board. They worked in the same system I did, and they didn't know. You know, they did what we did. I mean, we all did it. Everybody's shocked. Everybody was shocked that I was found guilty of that, but it only comes up on a day like today, you know, depositions, it comes up or something. Somebody wants to try to discredit me. In my day-to-day practice, I'm never affected by it. You know, I see patients. I do a good job. I'm conscientious about it, and that's all it is, if you want to get down to it.
Mr. Brigg, do you think that there should be regulation?
Yeah, I do.
If you didn't do this stuff, then why did you agree to it?
Well, why do people do a lot of things they agree to? You know, you practice this. I mean, I don't practice it. What was my better way out? I could pay $2,000, and they told me, oh, you're going to still practice. Oh, we got nothing. We got nothing. We're not stopping you from practicing. You'll continue like you did. You're licensed. I was licensed all during that time. They didn't take my license. There was nothing. I mean, that was it. I didn't know how it was going to affect me years later, okay? Because guys like you bring it up. That's the whole deal. They won't expunge it. Thought about going to get some representative or somebody to try to help me with that. Because if I committed a real crime, it'd have been expunged. You know, they don't expunge this. And, you know, somebody wants to pull it out, bop me over the head with it, and call me a bad guy, but I'm not, okay? I practice very well. If I wasn't, I wouldn't be in business. I mean, I wouldn't be practicing 30 years. I mean, that's the whole deal of it all, would I?
Last question, Mr. Brigg. So is it your testimony that Tennessee Code annotated 6313-2091, which you pled guilty to, unprofessional, dishonorable, or unethical conduct, it's not against the law? It's not a law?
What's against the law?
I'm asking you.
What
You just
do you-
made the statement that you didn't do anything. You didn't break the law.
What are you saying is against the law? I mean, what? That I did something against the law?
Sir,
I
you signed
supervised-
an order that
Okay,
said that
okay.
you did.
Talk one at a time, please.
Well,
Mr. Griffith, I'm fully in control of this deposition.
My last name is Van Horn, and from what I see, you're not.
Okay.
Both of you are talking over each other and making a mess of a record, and the court reporters had to ask you at least once to talk one at a time. So no, Mr. Van Horn, who I am, doesn't think you're control.
My apologies. I know who you are.
Yeah.
I just didn't want to call you by first name. So, when you say you didn't break the law, you're saying you didn't sign this? Is that what you're saying?
I signed it. In my mind, there are a lot of extenuating circumstances here that nobody wanted to hear. Such as the person who reported me, who had an interest in something. They had a husband in the program, and she never asked any questions why he's in the program, and in the end they're unhappy because the doctor released him back to work, and that's what this is all about. The girl offered, she wanted to know if me and my assistant would come work for her. They were planning on starting a home health agency. That's what this is all about. Nobody wanted to hear it. I'm shocked. I hate it because I'm still upset about it, okay, if you want to get it, because that's not what I was doing, okay? But nobody wanted to hear it. Wish I had a day in court to talk about it. But even now, if I call over there and ask for a document like this, I'd like to have a document they say, look, you're free and clear, because when I see guys like you, I can pull that out. Hey, look what they say. They won't even return their phone call. over there. What's up with that, man? You got an organization that won't return your call, like a bar that won't return your call? That's what we got, okay? It's not good.
Mr. Brick, that doesn't surprise me at all.
Well, okay.
In your case.
Well, thank you,
No
thank
further
you.
questions.
Thank you very much.
Object to that last comment and move to strike
I
his
mean, I don't
argument.
know what he even said. I thought that was that's not a compliment.
No, it was not a compliment.
Well, I mean,
I have no further questions. Rachel, do you have any questions?
I just have one question. Mr. Brick, my name's Rachel Hogan. Sorry we couldn't meet today. I'm in Nashville. What is your active Tennessee license number?
6000068.
Do you happen to know your license numbers for Mississippi and Arkansas?
Arkansas is OTR 360. Mississippi, I'd have to look. I don't have it on me right now.
Okay. That's all I have. Thank you.
I think we're done.
Okay.
This concludes today's deposition, going off the record at 4:46 p.m.
See that. Yeah, I appreciate that, man. That's good. That's good.
Right, and
We
you
just-
take off your microphone, Mr. Brick.
Yeah, we just make sure you take out your microphone when you stand up.
Go ahead and give me your file, let me get your, do you have a
Uh,
secretary or something that can be copying that?
I do. I may have to guide them in this. Hold on.
See you, Rachel.
Thanks.
Bye now.
Let's see here.
Catch up. Okay.
Yeah, I'll make a copy of it. I'll give
You
it
can
back.
have that.
You sure about that?
Yes, sir.
Yeah, somebody tendered you as an expert in something, and a court said, tough. You're not an expert.
Oh, really? Okay. Well, that's the first I know where I hadn't been qualified as an expert.
Original for you,
Yep,
copy for you?
Yes,
and I like E-Tran.
All right, thank you. We got you.
You want the video
Yep,
first?
yep. Where's that restroom?
Oh, yeah. Walk down the hall.
Yeah.
And it'll be on the right.
Okay.
There's one straight ahead.